Congratulations! I am so glad you have decided to move forward with your procedure, and I'm excited to see the final outcome. But before we get there, a couple things to consider to make it as smooth as possible. To prepare for surgery, please pick up your medicines that were prescribed as soon as possible. I would like you to start the antibiotic a full day before we do the procedure. Meaning, if you have your procedure scheduled on a Wednesday, for example, I would like you to start your antibiotics on Tuesday morning. That way you have a good amount of medicine in your bloodstream as we do the surgical procedure, which may inadvertently cause some bacteria to enter your bloodstream. Also, I would like you to have some Tylenol and ibuprofen on hand if you can take those. These have minimal side effects and are very effective if taken at the right dosages, and we will provide you a sheet of paper for that. Also have some soft foods on hand so that are easy to eat, like soups or mashed potato, fish, pasta, those kinds of things that you don't have to chew very long since you'll have a wound in your mouth. And then also you want to ice, right? Icing is extremely important, often underestimated, but very effective at not just controlling swelling, but also the associated pain that comes with it. Have your driver bring you to the appointment. You can certainly take your medicines in the morning as you usually do, but if you're sedated, I want you to refrain from eating or drinking anything after midnight because we need your stomach nice and empty so that you can handle the sedation very well. If you're not getting sedated, I do suggest that you eat a good meal because you'll be sore after and it'll be harder to eat after. Now, after the procedure, lots of rest, lots of fluids. Let your body rest and heal. It's very busy and active healing that wound that we caused, and you want to support it as best you can. If you experience bleeding, put some pressure on the area. We will provide gauze, and if that is not as effective as you think it should be, go ahead and take a black tea bag. The black tea will cause the blood vessels to constrict. That's the tannin in the tea. You want gauze and tea to be wet as you put it in your mouth because you don't want the blood clot to bind to either the tea bag or the gauze and then pull it out as you remove that. Ideally, you keep that in for 15 minutes and bite hard. It'll seem like a very long time. Don't talk during this time. And if you feel like your mouth is filling up, just go to the bathroom and hold your head over the sink or have a towel ready so you can catch what comes out. Now, if it's bright red and liquid, it's mostly saliva with some blood in it. But if it's dark and a big clot and it just won't stop, then certainly call the office and we'll be glad to bring you back and make sure that we control your bleeding on site. If you have any questions, don't hesitate to call us. We're always here for you, and I look forward to seeing you and getting treatment done and seeing the final outcome.